It's a field in medicine where you specialize with the lower limb.
For some reason, I thought podiatry has to deal with the feet only.
Yes. So if you have a pain on your lower limb, on your hip, on your knee, on your feet, on your leg, you go and see a podiatrist. The reason why people don't know about podiatrists is that in the whole of Africa, it's only UJ that offers podiatry.
Oh my
so
God.
I'm actually the first Benda girl that graduated from
Wait, let me greet my people. Guys, you know, we already went on to this video before we actually start. So we really got to repeat what we were talking about and what we're laughing about right now. So yeah, welcome to yet another video. If this is your first time watching, my name is Arehone and welcome back to my channel. This segment is called Tackling Careers with Arehone, and this is where I share information about careers, jobs, and anything that you guys would love to find out about any careers. And today my guest is Fhatu. Welcome.
Thank you.
I don't know whether if I should say welcome. Yeah, I must say welcome actually because it's my channel. Besides me being at your place, this is my channel. So welcome to Tackling Careers with Arehone. And today we're just gonna go deep into what she studied, which is podiatric medicine. If this is your first time hearing about this, here's a career opportunity. Here's something you can consider, which is also in the health science field. Like I said in the previous video where I was speaking about radiography, that the health science is not only limited to nursing, to physiotherapy, to MBCHP. There's a whole wide range of other careers that you can do and succeed in within the health science vicinity. So yeah, I already mentioned what you studied. So I just want to hear from you, what is podiatric medicine? Because like for someone watching who doesn't have an idea what podiatric medicine is, what is it? Like just in simple terms, the way you'd explain to someone who's doing matric, someone, even if they're not doing matric, someone who just doesn't know about the course, what is it?
Okay. Hi. So podiatric medicine is a field in medicine where you specialize with the lower limb. So you are actually a doctor, but you don't get like a DR title. But then you are a healthcare professional that specializes with the lower limb. Let's say you have a toothache, you go to see a dentist.
Yes.
If you have a painful eye, you go see an optometrist.
Yes.
So if you have a pain on your lower limb, on your hip, on your knee, on your feet, on your leg, you go and see a podiatrist.
You know what I find interesting is that for some reason I thought podiatry has to deal with the feet only.
Just the feet.
Because now you mentioned lower limb. So if someone has a problem here with the thigh, that's part of your lower limb.
Yes.
You can also help them,
yes.
assist them.
So when you speak of the lower limb, we talk from the hip going down to your feet and your toes.
Yes.
That is the lower limb.
Why did I think it was only wound care where people have sore feet and everything?
There's just a lot that we deal with, honestly, because you don't just deal with wounds, with corns, you deal with sports. There's a section called sports medicine. So that is where you deal with your runners, you deal with your rugby patient, you deal with people that run marathon.
But then now you link with physiotherapy a bit.
Kind of. You can be linked with physio, you can be linked with OT.
Okay,
occupational therapist. Yes.
Okay. So but now then what would you do with the runners? Like what are you helping them with?
Okay, so let's say you are going to run a comrade marathon, eh?
Yes.
So we need to check your feet to see which specific shoes do you need. So you've got your anti-pronatal shoes, you've got your anti-supination shoes. So we need to see which specific shoes do you need, or which specific running shoes do you need. Yes. And then also sometimes you will find that there is like you went to run your comrade, but then you come back with the blisters. So we need to check that to see what happened. Also, was the shoes not what you needed and all that.
Oh my God, like, why? How come, guys? But is just always laughing like this, ne? She just has a happy face. But how come it's not a career which is very out there? And you know, there's certain problems that we experience, and you think you just, you know, for example, sometimes I'll have like a little hard something on the side of my toe. For you guys, you can see that as a problem.
Yeah.
And for me, I just feel like, oh, this shoe doesn't sit well. And I remember there was a time where you looked at my feet, you were like, hey, there's something. You can already diagnose or see that there's a certain type of, wow, guys, like, I'm actually learning a lot about podiatry.
So I think the reason why people don't know about podiatrists is that in the whole of Africa, it's only UJ that offers podiatry.
Oh my
so
God.
They don't have it at Medunsa, they don't have it at UP, at VET. So it's only UJ. And then this course, actually, when I enrolled for it in 2012.
How did you know about it?
I will tell you.
Okay.
Yeah, so when I enrolled in 2012, it was actually, I think we were like 10 black people, and the rest was white and Indian. So this course was mainly
raising the flag for the black people.
Yay. I'm actually the first Benda girl that graduated from the class. Yeah, so yeah, that was happening with podiatry. So it was mainly for white people and Indian people. And then it's just now that we're starting to infiltrate it.
That's lovely.
It's
You make me want to go back to school and study.
Is it?
Yeah, like
podiatry.
yeah, something. But you know, the more you grow, you're just like, you've got responsibilities. I gotta look at that. If it was a part-time course, maybe, because I'm all about just studying and learning and everything. But you already answered the second question I wanted to ask you as to where do you study it? Where do you study the course? So even like your big university, that's right, UCT, UP.
But long time ago, when you read the history of podiatry in Africa, it was actually integrated from vets. So they had certain modules like your sports medicine, they will attend it at vets, and then you'll have anatomy at vets, and then other modules at UJ. It is now then that it's only at UJ. It's no longer integrated with other universities.
Yeah, but my question now would also be, but a doctor can also do functions that podiatrists do?
Yes.
The work?
But not all of them. Like they can treat wound, but they won't have time to be debriding your corn, to be removing your corn. They won't have time. They will have to refer. They can still do basic, but there are other things that will actually need a podiatrist to go in there and see what is happening.
So as a profession, you called a podiatrist?
Yes, I'm a podiatrist.
Because you know, with all medical degrees, whether optometrist, everything in our African, we just say doctor to everyone.
Yeah, that's true.
That's what we call them, because in Venda, essentially it's translated as that. Yes.
Yeah.
So it's a doctor. She's a doctor of legs.
Yes, I'm a doctor of feet.
Dr. Feet. Yeah. But I've always seen that Dr. Feet.
Yes.
People writing Dr. Feet, whatever. Maybe they okay. But this is very interesting. Okay, now when we go back to university, what do you need to actually apply for the course?
Okay, you need your maths, and then pure maths, and then also your physical science, and then there's life science.
And
life sciences as well.
Something that you mentioned that you are actually one of the few black people and the first Venda person attaining the degree.
Yes.
I wanted to know, how did you then know about it? I mean, you're just a young girl coming from Venda, the village of Chikwarani. How do you know about such? Or did you just guess apply? You know, like how did it happen? Did you know what you were applying for? How did you apply for it?
Yeah, so I was well aware of what I'm applying for. So what happened was my grandfather, he was working for a government. No?
Yeah.
It was in 2011. So what happened was he had problem with his lower limb. So he had to attend some orthopedic surgeon. So that guy, one day I went with him for his checkup, and then I was very interested of what he's doing. So I asked him more about lower limb, and then that is when he advised me that actually there's this course that black people are not much aware of, and there are a lot of opportunities, so you can actually do it. But what I wanted at first, it was radiograph and pharmacist. And then, yeah, so when this one came, I was like, okay, let me just give this one a try and see. Yeah, but at first, you know, when you go, you were born and bred in Limpopo, in the villages, and all of the sudden you are here, it's full of white people and Indians. So I had
intimidating,
very intimidating. Also, I had a challenge with language.
Yes.
I did my English in Venda.
First additional.
Yes.
No, you did it in Venda.
Yes, I went to a government school in the villages, so everything that you were doing, we're doing it in Venda. So now here I'm coming, it's a big city, and then it's white people. I need to speak in English all the time. So that was a challenge for me. I don't want to lie.
But you did it anyway.
Yes, yeah, but I felt like at that time my English was not good. Like it was not good.
But it just goes to show that you don't need that fluent English to pass a course.
Yeah,
because
that's true. That's
and coming to the course part, like the measures, what did you measure? What did you measure in? I'm sure English was not part of the measures.
No, it was not fully from
like
high school.
No. In varsity. What was the measures of the course? Like what do you do? Do you do anatomy?
Yes, I think first year you will do anatomy, and then you will do physiology, but you do them as anatomy and physiology first year. Second year you will do anatomy separate. You'll have your dissection. You know dissection?
Yes.
Yes, you'll do your dissection, and then you do your theory, and then you do physiology.
So do you dissect the lower limb? The entire body?
Yes.
Oh, okay.
Because at the end of the day, it links
the brain. You need
connected.
the brain to work. All the nerves, the nervous system is coming from there.
Yeah.
All the why am I even asking that? I shouldn't even ask a question like that. But yeah, it's very much linked. And you see, there's actually no English as a subject, so
I was
so happy. You just needed your life science.
I was happy that I don't need to be talking about past tense and present tense.
Exactly. So it was just a basic English.
It was. I mean, I survived. Here I am.
Survived.
But now my English is getting better by time.
Wasn't that bad? Wasn't that bad?
It was very bad.
Oh, bad. Okay.
Bad, but yeah, it was basic.
And then going through the varsity process, how was that for you? Okay, besides English being a barrier, what was some of the difficulties and challenges you found while doing this course? Like, up to, how many years?
4 years.
The 4 years degree. Okay, and then why did you find this a challenge? Unless if you don't find any challenges.
Oh well, I didn't have any challenges. Like the academic part, I was good at it.
You loved it, no?
Yes.
Do you love life science as well?
I did. Life science and physical science, it was my thing. Yeah, but challenges at varsity, there was no any challenges that I can highlight here.
Just swept it through.
Yeah.
Didn't repeat.
Oh well. it's a story for another day.
She has the degree now.
Yeah, that one.
Okay, so I want to know, after getting the degree, now you're going into the working space. Where do you start? How did you start? Did you start also, because a lot of health science courses, you have this thing where third year, I think you got. I'm not sure about podiatric medicine, but I guess it should be the same for all other health science courses, where you go to the hospital and you start working and seeing what they actually do in the hospital. Did you do that?
Yes. So with us, it actually started in second year.
Oh,
so second year we started doing our practical, but we had like a UJ podiatry clinic, so we'll do them there. And then third year and fourth year, that's when we went out to other clinics.
Go to Helen Joseph there next door.
Our campus was at Doornfontein,
Oh,
next to Hebrew.
Okay.
Yes. Yeah.
Oh, okay. No, I just see the main campus there
Yeah.
when I'm working around that area. Oh, okay. All right. And then now that you're done with the course, how do you get into the working space? How, is it easy? Is it hard? How do you get into it?
I think getting into the workspace was very tricky for me. It wasn't hard because with me, after my 4-year degree, I actually went private, so I opened my own practice.
But you're brave.
Yeah, it was very it was,
Like,
it was a very big decision to take.
You know how some people actually start by going to work for government?
Yeah, that's true.
And like you just decided that you're gonna open a practice.
Yes, so I opened my practice in 2018, and then I went to government 2020.
So opening a practice, did you need to have capital? Like funds?
you need to have capital, but not that much. I mean, it depends how big and how small you want to start. With me, I started very small, and then I grow as time goes.
But then when you start a practice now, where do you find the clients? Some people don't even know about podiatry. Do people get referred to you?
Yes,
as a podiatrist, can I walk into a podiatrist?
Yes, you don't need
practice.
a referral. Yeah.
Okay.
But then you find other doctors that actually knows what podiatry is, and then they can refer. But then there are others that are not even aware that there's actually this person exists. Yeah. So, but I feel like if you want to branch into private, you really need to work hard. You need to be able to do your own marketing. You need to be able to be your own accountant.
It's a lot.
You just need to do everything. Be your own receptionist.
It's an entire business. You need to pay rent. You need to pay all these things. That's what I'm saying. For a person who just attained a degree, it's a risk, and I hate the fact that we see it as a risk, especially as Black people. Because it's an achievement more than anything.
Yeah, that's true.
Yes, a business is a risk, but wow, kudos to that for taking that opportunity and saying I can actually do this. I can actually start this.
That's true.
It's very motivational. And then the government space. How do you move to government space? And I want to understand, is the work different as well? Compare in practice and government, or it's just the same thing?
Well, I think the challenge is that UG, so we don't have internships, you don't have ComServe.
So after graduating, you don't have ComServe.
Yes, you are an independent practitioner. So you go and obtain your HPCSA not as a ComServe, but as an independent practitioner. So that is why.
So you don't do ComServe?
No, we don't do ComServe. There's no internship for us. Yeah. So you can actually get a job from government and be an independent practitioner and not work under someone.
In government?
Yes, in government. Then you can still branch to private and work as an independent practitioner, just like what I did.
Oh, yes. Okay. And then in government now, like I want to understand what you are doing, because you say in government now. Is it patients that just come to the hospital and then they someone, I don't know, diagnoses them and say, no, this patient needs to go to a podiatrist, and then they come to wherever you are?
So what happened in government is that you have your walk-in patient that knows that there's a fit specialist, and then you also have like your referrals from other departments. You can have your referrals from your dermatological department, from your neuro, from your GPs as well. Yeah, but then I think the work is still the same.
Yeah,
I think the difference is just the working environment.
Yeah. Yes. And how big is this market? Do all government hospitals have feet specialists?
No, not all of them. It's just your tertiary ones like your Bara, your George Mukari, your Steve Biko. Yeah.
Okay. No, I'm actually learning a lot. I'm glad I'm here. I'm glad I'm doing this, because I'm also learning a lot for myself, and also for when I go there, when I want to try and tell another person about a certain career.
Yeah.
What I also wanted to ask, which is very, very important when you're working and growing and just elevating in life,
Yeah.
in those careers, are there any opportunities to grow? Like, if they are, what are the opportunities?
Yes, so more especially when you are in a government setting, you can actually branch into public health. It's what I'm doing right now. So
Yes.
I'm starting my diploma in public health. So that allows me to actually do something different in government, something different from podiatry. So you can actually be a hospital manager, you can be operational managers as well.
And I think you have an advantage when you're already within the system.
Within the system,
then now you can try and elevate. Okay, and then what I wanted to know, with the same degree, the pediatric medicine degree, what else can you do? Are you only limited to just being a podiatrist? Like, what else can you do with the same degree?
Okay, so with the same degree, you can actually go and practice in Canada and also in Australia.
Okay.
So there are actually good opportunities outside South Africa. Actually, if you
and financially, they're also better in Canada.
Very good.
But it's just that if you already have a family and everything, you have to think about everything else.
Yeah. So actually 2 weeks ago, I was writing a testimonial for one of my locum. Is actually going to Canada.
Wow.
So yeah, there are more opportunities outside South Africa.
Guys, you know, sometimes I just want to say, I know people are going to say I'm not that old, but I just want to say minus 21 years. I'm not 21. I'll be like 7 years old, 8, 7. I'm saying I want to say minus 8 years and go back and make different decisions, you know. But yeah, it's because of the learning that I'm getting from this segment of Tackling Careers with Arehone, and I just hope you guys are learning as well, as much as I am learning as well. And I hope this is helpful. I don't know if you have any other advice that you might have for my people, degree related or anything, like just
Yes. So actually, as a podiatrist, you can actually be a medical rep.
Oh, you can also be a medical rep as a podiatrist.
As a podiatrist for you know that company called Smith and
Nephews.
Yes, that one.
Okay. Do you know of people who are like also podiatrists who are
I know
who are a medical rep?
Yeah.
So a medical rep is basically a sales representative who sells products through clinical training. So most of the time, medical rep, you need to have like some sort of health related degree, because you need to have some sort of knowledge. It's not just like any normal sales where you can sell anything. You need to have some sort of knowledge. So that's another option you can take, or another route you can take if you have the degree and you're not using it as a podiatrist. Any other?
Yes, you can also work under a medical aid scheme.
Like Discovery. Investec, I think, also has such. So you obviously can't just sit with the degree and say that degree is not working for me. But we do know, we are considerate of the fact that the unemployment rate is high. But having such a wide option that you can do other than what the degree can do for you is actually an advantage. And yeah, I think that brings us to the end of the video. But thank you so much. I really appreciate this moment. I appreciate this. I appreciate this information. I think it's gonna help someone out there. And yeah, I enjoyed this. Yeah, thank you so much for watching, guys. Please like, comment, and subscribe to my channel. And if you have any questions, please do put them on the comment box. And obviously, if they are podiatric medicine related, I'm gonna ask Fhatu to help me respond to those questions. So put all those questions. If you have more questions, if you still don't understand, put the questions in the comment box. And yeah, that is it. Bye.